Operations can be a scary thought for many owners, and while operations do carry a certain degree of risk, veterinary surgeons do everything within their power to lower the risk. This video will go through the steps that will happen before, during, and after a surgery on an animal or pet. Admissions. So in the morning of the procedure, the owner will have an admissions appointment. This will be where the veterinary nurse or veterinary surgeon will be there to discuss the procedure and to ensure the consent form is completed. Admissions usually last around 15 minutes. Consent form will detail what the operation will be, provide an estimated cost, and allow for discussions of any concerns that the owner may have. While the animal is in our care, it is important that we have contact with the owner at all times. This can be to keep the owner updated on their pet's progression and in case of any emergencies. If an animal has any medication, it is important to inform on admissions and when the medication was last given, and if there is any changes since the animal's last appointment. When in admission, it is important for the veterinary team to introduce themselves to owners and pets, as this is important to reduce stress of both parties. This is because pets, such as dogs, can read and react to owner signals, so by reducing the stress of the owner, it can help reduce the stress of the patient. On admissions, the patient will also be fitted with identification neckband and placed in a housing appropriate to the animal. Pre-operative. Before an operation, with your pet having gone through the administration phase, they will then be taken to given any painkillers or pre-anesthetic injections that can be done before their operation. This can help reduce the stress of the pet and reduce the dosages of anesthetic given throughout the operation. But before the operation, your pet will be weighed to ensure the correct amount of anesthetic is given. Your pet will be housed in a comfortable area to allow for the medication to have full effect. And the area in which surgery will take place will often be shaved to clear the area that will be worked on. Anesthetic. Anesthetic can be administered by injection or inhalation. It stops the brain from recognizing messages from the nerves. This means that the animal will not feel pain while under anesthetic. On the day of the operation, a catheter will be placed in the vein to allow for the administration of the drug and fluid during the surgery. The other way of anesthetic being administered will be by placing an endotracheal tube down the trachea. While under anesthetic, the animal will be constantly monitored by a veterinary nurse to ensure no complications happen. Peri-operation. This is when the operation is taking place. While the operation is taking place, the anesthetic will be monitored throughout the surgery, as well as other equipment will be used to measure the blood pressure, the heart rate, oxygen levels, and carbon dioxide levels. This can help to detect any problems and ensure the patient is stabilized. Post-operative. Post-operative is after the surgery is taken place. Post-operative, your pet may be kept in the veterinary practice for monitoring their recovery. Following the operation, the site of the surgery will be checked daily for changes. This can be swelling, discharge, redness, or bruising. The owner will be asked to visit the vets a week after operation to check the healing process. Depending on the site of the surgery, your pet may need a Victorian collar to prevent the animal from agitating the operation site. This can be by licking, nibbling, chewing, or scratching. Nutrition. Sometimes after surgery, veterinary surgeons may discuss a nutritional monitoring and feeding plan. This is to support early caloric demands. Selecting a diet that is highly palatable, calorically dense, and provides a concentrated energy source is ideal. Warming the food or presenting different textures can increase palatability, and by monitoring the diet, it can prevent hyperexia or anorexia, as nutritional needs can change daily. Fluid therapy. This is one of the most frequently used therapies in the veterinary practice. Fluid therapy is used for many reasons: dehydration, support of the intravascular volume, correction of the electrolytes disturbances, and encourage the redistribution of fluids within the body. Drains. Drains can help with the process of healing, as it can remove inflammatory mediators, bacteria, foreign objects, or necrotic tissue. Drains help with the monitoring for complications, as it allows for easy sampling of fluids during the healing process. The main use of drains is to remove dead space that can develop between the destruction of the connective tissues. This is undesirable, as fluids can fill this space, which then forms a prime area for bacteria to grow. While drain is good, there is also a risk of infection and patient morbidity if the drain is placed inappropriately. And that is the end of this presentation. As always, the references are all displayed on this page. Thank you, and I hope you have a wonderful day.